Hello everyone, I'm Hee Jeong Yoo, a child psychiatrist from South Korea. In this video, I'll be sharing some tips for general psychiatrists on effectively working with children with ADHD, which is one of the most common neurodevelopmental disorders affecting from 6% to 16% of children and adolescents. Tip number one, be attentive to inattention symptoms. ADHD often presents itself through academic or behavior issues in children and adolescents. Its core features are inattention, hyperactivity, and impulsivity, which emerge during early childhood. While hyperactivity and impulsivity are usually evident through excessive motor activity and impulsive decision making. However, identifying inattention symptoms may require extra attention. So, it's crucial to pay close attention to signs like difficulty sustaining attention, forgetfulness, and distractibility. Keep in mind that ADHD can coexist with other conditions such as tic disorders, mood disorders, anxiety disorders, specific learning disorders, and disruptive behavior disorders. Differential diagnosis is crucial to provide accurate treatment. Your clinical expertise will be invaluable, especially when dealing with mood and anxiety disorders, as diagnostic principles are not fundamentally different from those used with adults. Let's move on to tip number two. Try to collect information from multiple sources. The diagnosis of ADHD is primarily based on clinical judgment, derived from direct observation and information obtained from individuals close to the child and adolescent. During interviews, observe whether the child displays ADHD-related behaviors, becomes easily distracted, or fails to listen attentively. If possible, directly inquire about the child's experiences and behaviors at home and school. But remember, relying solely on direct observation may not provide a complete picture because the observation period may be brief and the behaviors may be attenuated in the clinical setting. Also, we should know whether the behaviors appear in the child's general circumstances, for example, both at school and home. And we should know developmental history, whether the behavior started from early childhood and have been maintained at least during past 6 months. It's important to gather information from various sources, including parents, teachers, and any other individuals involved in the child's life. While obtaining teacher report directly may not always be possible, parents or guardians can be asked to provide school reports. Utilizing rating scales such as SNAP-4, SWAN, and ASRS for adults can also be highly beneficial in the diagnostic process. Keep in mind that neuropsychological tests can serve as supportive tools but lack specific psychological tests exclusively for ADHD. Tip number three, work with parents. Since ADHD is a chronic condition, effective management involves psychoeducation. Provide parents precise information about what ADHD is, its causes, various treatment options, including pharmacotherapy. It's essential to correct any misconceptions they may have about their child's behaviors. Empowering parents with accurate information can have a profound impact. Parents should understand that their child's challenges and academic underachievement are rooted in biological factors and not a result of their parenting or the child's intention. By establishing this understanding, you can build a strong therapeutic alliance with parents, promoting cooperation throughout the treatment process. For elementary students, consider teaching parents strategies to support their child's executive functions, such as structuring daily routines with checklists, setting time limits for tasks, using planners, and implementing real systems. Encourage parents to seek assistance from the school systems when available. Finally, tip number 4. Medication may be necessary if ADHD symptoms significantly impact a child and family's life. If you decide to use medication, stick to guidelines. It's crucial to follow evidence-based, age-appropriate guidelines and monitor the child response carefully. Various medications, such as stimulants like methylphenidate, amphetamines, a norepinephrine reuptake inhibitor, atomoxetine, and selective alpha-2 adrenergic agonists like guanfacine and clonidine are available. Generally, stimulants are considered first line for addressing core ADHD symptoms, followed by atomoxetine. Remember that approved medications may differ by country and have specific age restrictions. A few essential principles of pharmacotherapy should be noted. First, establish realistic initial goals and identify specific symptoms that medication can help address. For example, medication may reduce hyperactivity and distractibility, but is insufficient to teach desirable behavior. You should accommodate your own goal and parents' expectation before you start medication. Second, be aware of individual differences in medication effects and side effects. Titration to find the optimal dosage is necessary, but be prepared to switch to another class if side effects outweigh the benefits. Honest and unbiased communication with parents, along with the use of rating scales, can aid this process. Lastly, monitoring is paramount throughout pharmacotherapy. Conduct safety-related laboratory tests before starting medication and regularly monitor the child's growth as necessary. Make sure to refer to textbooks and practice guidelines and standardized medication lists for appropriate selection and titration strategies. Here are the links of freely available resources on the next slide. I hope these tips will enhance your confidence in working with children with ADHD and their families. Thank you for your attention.